In this episode of Alachua County Talks, we will be speaking to Dorothy Thomas and Mclinda Gilchrist, two women who have been instrumental in the success of SWAG, the Southwest Advocacy Group. Dorothy Thomas lived in North Carolina and New York before moving to Gainesville, Florida in 2010. She has been involved with SWAG since 2012, including serving as past chair of the SWAG board. She's a current board member and a founder and chair of the Child Center Board of Directors. She and her husband Scott have two children, William and Anna. In addition to her work at SWAG, she's active in both of her children's schools and is on the board of the Community Foundation of North Central Florida. Dorothy was one of the leaders of the effort to bring the Children's Trust to Alachua County. Welcome, Dorothy.
Hi.
So it has been an amazing journey. Watching what's going on with SWAG, and as you well know, the County Commission has been really devoted to the effort. Let's start though just by talking about how you got involved. How did SWAG come up in your life?
So SWAG was really an accidental blessing for me. One of my kids' classes in preschool was collecting coats. And for some reason or another, the lady who was supposed to deliver the coats to the resource center wasn't able to bring them that day. And she asked if I could drop them by on my way home, and I said sure. And so I showed up with a box full of coats in this little tiny yellow building that I never knew existed. And I went in the door, and a person who I later found out was Joan Canton, who was one of our founders, met me at the front door. I said, "Hi, I have these coats. This is a really interesting place. What's going on here?" And she told me a little bit about what SWAG was and what SWAG did. And she's like, "If you're interested in volunteering, you should talk to Katie Fields, who was the manager at the time." And it was kind of an immediate love. I started volunteering as soon as I could get my paperwork filled out, and have been eyeball deep in SWAG ever since.
Did you have any idea what you were getting into at the time?
None whatsoever. In fact, to do the background screening or whatever, they asked you to commit to a certain number of hours of volunteering a week. And I said, I'll just pay for my own background screening, because I don't know if I'll be able to commit to spending an hour a week every week at SWAG. Little did I know that, I spend most of my hours every week at SWAG now going forward. But at the time, I had no idea what I was saying yes to.
So, one of the legends in this community is the two Dorothys. Did you know Dorothy Benson, who is also, incredibly involved in SWAG? Did you know her at that point, or did you meet her through SWAG?
In fact, when I first volunteered at SWAG, Dorothy Benson lived in Kentucky. She had moved away for a while, and so for, I don't remember, a year or 2 years, I only knew her via email. And I got very involved very quickly, and I would need, a point of clarification or a contact person at a particular organization, and so I would email her, and I think we may have become Facebook friends, so I kind of knew what she looked like, but I had never met her until probably a good 2 years after I was involved in SWAG. I remember when she first moved, I took a lunch over to her house, and I was nervous. It was almost like a blind date of somebody that I had known for years. I felt like we had been matched up on, some sort of online dating service, and we finally met each other in person for the first time.
So, talk to us a little bit about the history of SWAG. Can you tell us where SWAG is roughly in the community?
So SWAG is on the little corridor along the I-75 where the overpass on 20th crosses over that overpass. So it starts there, and it kind of backs up towards the Home Depot and that whole little triangle of communities. Technically, there's 7 neighborhoods in what we now call the SWAG community. Historically, it was called Sugarfoot. Geographically, it's that little southwest area in that triangle between the interstate, the overpass, and kind of Tower Road.
And how did the Southwest Advocacy Group begin?
So there's a very long story that I'll try and give you the condensed version since we only have a few minutes. But essentially, that housing had been built initially as student housing. And as UF continued to build housing closer to campus, the housing became empty. It was vacant. And landlords, as a way to fill previous student housing with tenants when it was sitting empty, began taking Section 8 vouchers, Unfortunately, a lot of the landlords were absentee landlords, so a lot of the homes in that area kind of fell in disrepair. The neighborhood was not well maintained. But around the same time that the landlords started taking Section 8 housing, an area in East Gainesville, a number of housing options in East Gainesville closed, so a lot of people that had Section 8 vouchers were looking for new housing, and so there was a big population shift from other areas in town into the SWAG neighborhood. Unfortunately, what happened was when low-income individuals moved to this area of town, none of the services that they needed to help support them and their families moved with them.
Right.
So it kind of became an area that was overlooked by a lot of people. Generally, that zip code is an affluent zip code, and so people didn't realize there were people who needed resources kind of tucked in those neighborhoods until around 2008, I believe it was. Dr. Nancy Hart, who was at the College of Medicine at the university, started seeing these disparities with respect to maternal indicators, so things like low birth weight babies, Medicaid births, other indicators. And so she and the Family Data Center at UF began looking into this a little more closely and started mapping that data by address rather than by zip code. And when they did, they found a concentration of these indicators of poverty focused right on the SWAG neighborhood, or now the SWAG neighborhoods. And she talked to other people, the Sheriff's Office, Child Protective Services, all of the different groups and agencies that track that type of data, and they had similar data. She put together an editorial in the Gainesville Sun, and a number of people saw it. And so people that were child advocates were interested. There were some community members, people like Dorothy Benson, who just saw it and was like, wow, I didn't realize that there were these high needs, a mile or so from where I live. And then most importantly, people that lived in the SWAG neighborhood saw it, particularly Joan Canton. And those various interest groups kind of came together at a meeting. There was a meeting at the library that was kind of, the magical moment that SWAG really started to talk about what could be done to better support families in this neighborhood. And Joan Canton stood up at the meeting and said, I was just, here to see what you guys were saying about my neighborhood. Let me tell you what's really going on. Let me tell you the resources we need. And that conversation really started a huge effort of advocacy with a great deal of involvement from the community, the SWAG community itself, along with all of these other organizations that ultimately ended up partnering with SWAG to create what is now the Resource Center, the Health Clinic, and the Child Center.
Thank you for taking that 2-hour story and condensing it into a couple of minutes. That was well done. Let's jump into the projects themselves, and I remember them well. And I remember your approaches to the county commission and your convincing them of the value of these projects. I guess the first big one was the Family Resource Center, is that right? Tell us about that.
So there was kind of a roadmap that, as I was talking about this community advocacy and really understanding what the community wanted, before any project was started, all the folks that were involved at the time did literally a door-to-door survey. As time has passed, legend has grown as to how hot it was. It was in the middle of summer. Everybody went door-to-door. It's kind of an urban legend in the SWAG community now. But the gist of it is that every house in the SWAG community was asked, what resources do you need for your family? And those answers set forth three main areas of focus. One was resources that were accessible within a close distance to people's home. The second was access to health care, and the third was programming for children. And so those three things ultimately became our three projects. The Resource Center was the first of those. The Resource Center actually opened in June of 2012. And the concept there is to provide place-based services of all the different resources low-income individuals might need. So think of everything from kind of your traditional emergency food pantry and clothing closet to after-school programming for children. We have a family support facilitator who meets with families one-on-one. So maybe you come in because you need food, because you're out of food before the month ends. But we don't just give you a bag of groceries and send you on your way. We sit down, we meet with you, we say, what's going on in your life that, we can make it so that this doesn't happen, again next month. What resources does your family need? What else is going on in your life? And oftentimes those concrete services open the door to much more significant services to understand what the family's going through and how we can support them. So I would say there's pretty much nothing that we won't entertain as a possibility of helping people. Oftentimes we don't provide the services, but we connect patrons to other organizations that can. I think one important thing to note about the Resource Center, as with all of our projects, is it's very much a partnership.
Right.
So SWAG is the advocacy group. We are the community-led volunteers and organizers and cheerleaders, so to speak. But SWAG certainly couldn't do what we do without the other partners. The county owns the building, and we can get all into how the county's involved in just a second. And the operating partner is Partnership for Strong Families, whose goal is to help reduce the number of neglect and maltreatment cases within the area. And so they provide our staff members and a portion of our operational budget, things like electricity and water and whatnot, and they're are the backbone of what happens at the Resource Center.
It's truly an amazing partnership between all of these agencies and the county. What was next? Was the clinic next?
The clinic came. Okay. The clinic came right, and we opened our doors in March of 2015. So the clinic was just kind of a dream when I first came on board. We still had some hurdles that we didn't even know were coming. Some of our original funding plans didn't work out the way we thought they were gonna, and so I stepped in to help kind of close that funding gap. But we opened our doors at the clinic in March of 2015. The clinic provides both health services and dental services. There's also a WIC office there. Similarly to how the Resource Center functions, obviously we are not doctors and we don't know anything about healthcare. We don't provide the services. We partner with the Alachua County Health Department. And so it's one of their satellite locations, and they run and operate the clinic similarly to how they do the main one.
Yeah, and you spoke about partnerships earlier. Paul Myers at the health department was instrumental in this, and I went back before the interview and I watched the video production we did on the health clinic, and it was truly a great partnership. And then the child center, the daycare center?
So the child center is, it's a different combination the way we have it set up, but essentially we provide early childhood educational services and supports to 53 children and their families. We have a big focus not just on what's going on with kids, but also family engagement, family participation, and also we function as a model demonstration center in conjunction with our partners at the UF Anita Zucker Center to try and raise the standards of early childhood care throughout the county and the state.
You service 53 children?
We service 53 children,
That's amazing.
Ages 0 to 5. We've sent 120 kids off to kindergarten so far.
Is that right? Yeah. I know there have been some, smaller projects, but important projects too. And as I was looking over the video today, I stumbled on the Pocket Park next to the Resource Center. That was a great day.
That was a fantastic day. The Pocket Park provides kind of an extension of the Resource Center, not just when the Resource Center's open, but on the weekends. It gives our kids a place to relax, to play. It's got tables. It's very much a thriving part of our community.
What are some of the other smaller projects?
One of the biggest things that the county has been involved with is the reformation of the road as part of the 8th Avenue connector, but also they've added in things like there's a paved walking trail that provides people a place for recreation. For up until, 5 years ago, our neighborhoods never had sidewalks. Now there are proper sidewalks that make it safe. You literally would have to push strollers through mud and potholes and ditches to walk along the side of the road, and now there's proper sidewalks. There's better bus stops where the bus comes. There's actual, ramps so that people in wheelchairs can roll up them instead of having to, just sit in the street waiting for the bus to come. Little things like that make a huge difference to people's quality of life.
Right. Can you tell us a little bit about the financial investment that has been made in these different projects?
So I think this is one of the huge testaments to SWAG and to the crazy patchwork of relationships we've built over this whole, 15-year period. So the county made an initial investment at the very beginning of about $415,000. That included purchasing 2 buildings that were in foreclosure, as well as putting some money in the to part of the renovation of the clinic. That $415,000 has brought back probably about $10,000 to the community since then. And I brought a cheat sheet so that I wouldn't make up the numbers, because there's a lot of numbers.
Did you say 10,000?
$10 million.
$10 million.
I might have said 10,000, but
That's
I meant
okay.
10 million. So I think this is really remarkable. So I looked at the money that Partnership for Strong Families and others have put into the operation of the last 12 years at the Resource Center. That's been almost $2 million. The clinic has also, over the last 9 years, the Alachua County Health Department, the cost to operate that has been around $2 million as well. We've received about $4 million in grants and private funding over all 3 of the projects. Our child center, we've already put in about $3.5 million for the operation of the child center. It costs about $650,000 a year to run that, and that comes from a hodgepodge of federal funding through Head Start, state funding, as well as private funding. And I think the most important numbers are not the money that we've put in, but the number of people we've served. If you look at our services, the clinic, since its inception about 9 years ago, has provided about 15,000 services to individuals. The Resource Center, this last year alone, we had about 14,000 visits and about 16,000 services in a single year, which with a staff of 3 people, that's pretty extraordinary. Over the history of the Resource Center, we've had 130,000 visits since we opened our doors. And like I said, at the Child Center, we serve 53 families each year. 120 of those kids have already headed off to kindergarten. So for each one of those numbers, for each one of those visits, for each one of those services, I think you have to think about what that means as far as an impact on a life. Those have been families that we have either helped come out of homelessness or keep out of homelessness. We have, kept families safe. We have, intervened in domestic violence situation. We've helped families get the support and the resources they need before their child is in danger. We have provided, educational services. We've helped people get GEDs. We've helped people find jobs. We've helped find resources for people with disabilities. The list goes on, but each one of those numbers represents a life impacted, and that's what we're there for, and that's what we're most proud of.
Very quickly, is there anything you would like to share about what's going on right now?
All 3 projects at the Resource Center, the clinic, and the Child Center are so busy. Everything is moving forward in positive ways. One thing builds on the next, that builds on the next. One of my favorite programs, we just had the girls that are involved in Girls on the run the 5K race. It was fabulous to see, kids participate in something like that. We've expanded our community gardening program, and we're hoping to start involving kids and seniors at the same time so that there's that intergenerational connection. We have continued to work with families at the Child Center to make sure that they feel engaged and strong in their advocacy for their children as they head off to kindergarten. There's lots of great things going on, and they really, all of our successes focus on the positive attributes of our community members. Our community is strong. It's full of amazing, wonderful people who are doing great things for their kids and their families. And if there's one message that I hope that this interview sends out, just because a community is a low-income community does not mean it's a weak community. It's strong, it's vibrant, it's beautiful, and we're just trying to help people build on the strengths they already have.
Thank you for all you do.
Thank you.
Good to see you.
Good to see you as well.
Mclinda Gilchrist was born in Marion Junction, Alabama, and moved to Gainesville, Florida 20 years ago. She's been in the SWAG area ever since. Mclinda did cleaning services when she first moved here and currently works at the University of Florida as a community health care worker. She loves her neighborhood, is a mother, grandmother, and a great-grandmother. Mclinda is a founding board member of SWAG and has been an active part of all things SWAG since its inception 15 years ago. She is affectionately referred to as the mayor because she knows everyone and is involved in everything in her community. Welcome, Mclinda.
Thank you.
So, I know when I was talking about your bio that you came from Alabama, and what year was it when you came to the SWAG neighborhood?
20 years ago. I can't remember the year.
So
upset because
right.
I came down. Was it after 9/11?
Okay.
Because my daughter was living in New York, and they moved down, and then I moved down to help my daughter with her kids.
So you were a member of the neighborhood before SWAG?
Yes.
Before all of that?
Yes.
And can you kind of give us a feel for what the community was like before SWAG?
Well, we had no access to nothing because even for myself and my grandkids, we always had to come all the way across town. I experienced that on my own because for medical reasons and stuff like that and getting all your medical things situated, I had to catch 3 buses to come across town.
Like to go to the health
department?
department?
To the health department.
Right.
So for me, that was just like too much, you know?
Yeah.
So
what were some of this? I mean, obviously healthcare was a big issue.
Oh yeah.
What are some of the other?
All the other resources.
Right.
All other resources that SWAGs provide now is what we did not have.
Because they're all kind of concentrated in the
Yes,
central
and it was way away
Gainesville.
from where you was at that time.
Right.
You had to, like I said, you had to take buses, 3 or 4 buses.
Right.
And at the end of the day, I experienced the fact that the day has gone by and it was not a bus to get me back across town.
You're talking about 3 or 4 buses to get there.
Get there and
one
get
way.
back.
Right.
Yeah.
Got you.
Yeah.
Got you. What was just the feel of the community or the general?
The feel of the community and being there all that time and to be involved in doing whatever you can to make a change, you know, and I involve all my kids, and like I said, like Dorothy spoke earlier, picking back up some of that we went from door to door to see what our community needed. We used to have a meeting at the library, and the word started getting out, and the county came in and helped us out and saw our needs, and boom, bam, we're floating now.
Yeah. So do you remember when the whole SWAG conversation first got started?
Yeah, with Miss Joan, because it was the greatest, the SWAG with Miss Joan. Like I said, all of us canvassed the neighborhood with her sister Eloise and Gloria. It was the greatest volunteers I ever met in my life, you know. So with all of us having the same idea, bringing something in all these neighborhoods was amazing.
Did you feel optimistic when you first heard about SWAG?
Most definitely.
Yeah.
Yeah, and still today, I'm very optimistic for the future because my great-granddaughter was our first little SWAG baby. And she's 18 years old now.
Is that right?
Yeah.
So she was involved in the resource
all
center.
the kids, yes. And my great-grandkids, the after-school program and summer programs, they're all involved. I'm still involved. We're all involved.
What kind of thing have you been involved in directly?
Whenever they need me, I'm still volunteer. That whenever Angie need me, she call me, I'm there.
Yeah.
You know, we do the farm share once a month. We do the sewing classes, we do the baby shower, so many things going on. And resources that comes in with more resources that we still have there, you know.
I am trying to wrap my mind around what it must be like for that community when we, Dorothy talked about the sheer number of projects, really transformational projects.
Yes.
One thing that was particularly interesting to me was I know when it comes to the health clinic that you have a kind of a particular and personal story about that, and you mentioned earlier that how difficult it was to get to the health
And I was
department.
the first client when the health clinic opened.
We cut the ribbon and you walked in.
Yes.
And do you mind sharing some of your personal story?
It was amazing because like I said, after seeing all this come to, to have, that you still there to be involved, and you can use those facilities for yourself, and seeing that you are the beginning of it, but you're still involved because it's helping you and your family.
Right. And I know you had a very particular health concern.
Yes, and then all my SWAG family was there for me. I was diagnosed with cancer 10 years ago, but I call myself a cancer thriver now, and I'm still thriving hard and doing whatever I do, involving everyone. And I also work with University of Florida, communal health worker, spreading the word about how important it is to get early detection and get tested for cancer.
Right. Now, what project is, of all of the different things, is the one that's closest to your heart?
Oh, I would say,
That's a hard one,
it's hard. Yeah, it's very hard because I try to involve myself in wherever they need me at and whatever we need to do. Mm-hmm. So it's not a really favoritism. I'm just there, involved in everything.
Mm-hmm. And what would you say is the, going back pre-SWAG, before any of this happened, what can you share just the general feel of the neighborhood and the difference that these projects have made?
It started, I think for me, it would be seeing that we have a place to be. We have a place that we could go to help ourselves, our children, our grandchildren, and all the people that in the different communities now that can come in to, for me, from the beginning to see it come to pass, that they have so much help in our neighborhood now that for me when I started it wasn't there, and to be here to live to see all that come to pass is just amazing. Yeah. I'm glad and just overjoyed to be a part of it.
There is, and I think Dorothy talked about this as well, this neighborhood was, I don't think in the general public consciousness, that is a kind of viewed as a really affluent part of Alachua County.
Yeah.
And, people were just, I think, unaware in general, but now that this light has been shined on it and so many of these services are now available, it's really become kind of a model for how to affect change in these neighborhoods.
And how change can come to pass once the people get together, want to see that change, and they work hard to make it happen.
Yeah. Well, I can't tell you how happy I am to have you here.
Thank you for having me.
For you to be a testament to what can happen.
I'm a swagger.
You're a swagger. You've got some swagger.
Yes.
Thank you so much.
Thank you so much.
My mother was always very familiar with her neighborhood, but one day she stopped at the stop sign for much longer than usual, and she didn't know whether she should go forward or turn, and she wasn't even really sure where she was at. It was very unsettling for her.
I felt so much better after my son told me, "Mom, I don't want you to worry or be afraid. I'll be there for you and we'll figure it out."